Hello, good morning, everybody. My name is Rony Wiranto. Today, I would like to present you my research poster. The title is Evaluation of Implementation and Satisfaction of Distance Learning Among Medical Students During COVID-19 Pandemic in Indonesia. So let me begin with the introduction. We know that COVID-19 declared as a pandemic by WHO on March 11, 2020 and has become the biggest challenge faced by humans since the Second World War. We also know that physical distancing is recommended by WHO in reducing the incidence of COVID-19. So schools and universities are temporarily closed, and distance learning has been implemented as an alternative to substitute conventional class. Medical student competencies, especially basic practice skills, become delayed due to the policy. It can affect the satisfactions of medical students toward distance learning. It became the basis of interest of the research. The aim is to evaluating implementation and also analyzing the factors that influence medical student satisfaction toward distance learning. The methods that I use in this research is observational analytic with cross-sectional study. The participants are 3,331 medical students in Indonesia respond to online questionnaire distributed by SMKI, or we call it as Ikatan Senat Mahasiswa Kedokteran Indonesia. So the result of this research, as we can see on this table, there are a lot of problems faced by students during distance learning, like limited internet quota, interruption of signal or internet connection, difficulty in learning, not reliable in using technology, limited equipment and facilities, irregular learning schedule. But the majority said difficulty in learning is the major problem that faced by students during distance learning. But the problem during distance learning are not only come from students, but also come from teacher. As we can see on this other table, we can see that the problems faced by teacher are interruption of signal or internet connection, learning materials become difficult to understand, not reliable in using technology, the learning schedule provided is uncertain, rarely gives lecture directly, the sound, visual, and learning materials are not good. So, but the majority says there are no obstacle by teacher during distance learning. I also research the factors that can affect the satisfaction of medical students toward distance learning. But in this research, there are four variables that influence the medical student satisfaction toward distance learning. The variables are the university origins, grouped by type, region, and accreditation. Also, the readiness are the factors that influence the medical student satisfaction toward distance learning. We know that satisfaction is the level of one's feeling after comparing the performance or result he or she feels with his or her expectation. We also know that distance learning, or we call it in Indonesia, is pembelajaran jarak jauh atau PJJ, is an educational system that has broad reach across space and socioeconomic, also time. The system opens access to education for anyone, anywhere, and anytime. But distance learning should be adjusted to the quality of the service provided by relevant institution and relevant people, so satisfaction toward distance learning will be achieved. It does have benefits, time flexibility, but too much time flexibility makes students less able to apply discipline. But the basis for determining student satisfaction toward distance learning are three principles. The first principle is access, and the second one is equity, and the third one is quality. Access, equity, and quality are the principle to determining student satisfaction. The conclusion of this research is distance learning is a solution to the medical education during this pandemic, but the related people, the related institution should be able to continue evaluating the system so that learning system remains efficient and also can be effective. Okay, that's it for my presentation for my research poster. Thank you very much for your attention.